Now, this is the Fox 11 5 o'clock news.
Major alert from the Centers for Disease Control. The number of lung illnesses associated with vaping has doubled in a month.
Yeah, about 450 people, 33 states being treated for a mysterious illness. 5 deaths are believed linked to vaping, including one right here in LA County. The CDC is urging the public to stop using the devices until they can pin down the source of that mysterious illness. They suspect vitamin E oil or THC may be involved. Many of the cases have been diagnosed as lipioid pneumonia, which means fatty oils getting into patients' lungs.
Joining us now to talk more about this is the medical director of the Pulmonary and Critical Care Services at Dignity Healthcare, Dr. Zafia Anklesaria. Thanks for being here with us. How
Pleasure.
concerned are you about vaping?
Becoming more and more concerned, Christine. It's unclear whether the attention is now because people are vaping more and more. Vaping has increased by more than 78% in the last 2 years, and it's catching the attention of the public eye. I personally, as a pulmonologist, I'm very concerned because, like you mentioned, the lipioid pneumonia is directly related to my specialty, and in the ICU, we tend to see a lot of patients coming in with these, quote, mysterious lung illnesses, which is basically inflammation in the lung membrane, which is preventing them from efficiently exchanging oxygen and carbon dioxide and resulting in the need for mechanical ventilation.
So, sort of what causes that? Is it the vaping? And why the increase in the vaping? Why do we think that?
So that's a great question, and the honest answer is that we don't have a definitive answer here, but we have theories. So vaping was introduced in 2007, it was FDA approved, and it was introduced as a, quote, non-toxic or less toxic alternative to cigarettes. And it's becoming more and more clear that it's probably not as benign as we thought it was. And what it's doing is directly aerosolizing chemicals into your lungs. And it's using high concentration of nicotine, multiple chemicals that we're using to add flavors to the jewel pods and other pods that are used. And also different organic compounds, such as what you mentioned, the vitamin E acetate.
For those of us who don't vape, is there a common product that people are buying or that are attached to these illnesses? Because I know one report said don't buy it from the streets for sure.
Yes, so in the most recent studies that have been done, they've noted that people who bought it on the streets have a higher incidence of developing what we're now calling vaping-associated pulmonary illnesses. People who are vaping THC-containing products seem to have a higher incidence, and in one case series, up to 80% of the ones that were diagnosed and confirmed cases had vaped THC. That being said, there were a significant number of cases that only did nicotine as well.
So obviously, as a doctor, your suggestion would be don't do this at all, don't smoke cigarettes, don't vape. Well, if you're going to do one or the other, because there's a lot of people that want to do one or the other,
right.
Which one do you do? Which one's better?
Oh, God. I still say neither.
Yeah.
There are several alternatives to getting over addictions to nicotine patches, medications that can help you quit. And it's just becoming more obvious that not only is it probably as toxic as cigarettes, there's a potential for it to be more toxic.
And then there's this in Michigan, just last week, they made history of being the first state to ban these flavors for vaping.
Right.
Is that something we could be seeing here in California? And is the thought behind that having to do with kids and getting them addicted to nicotine?
It's definitely a potential. So, like I said, it's a lot of the chemicals that they're investigating as a culprit are the additives or the flavors that make it more attractive to young people who are starting to vape. So as they piece together which chemicals and which flavor additives could potentially be responsible for these vaping-associated pulmonary illnesses, I can see them working to ban those as well.
So the industry, though, makers in the industry are standing up against, they're pushing back on the dangers of vaping. What do you say to people in the industry?
I say that as in any medication or any surgical procedure that that is FDA approved or recommended, it takes time to be able to see the long-term effects always. And we're now 10 to 12 years into the vaping craze with a significant increase in vaping over the last few years. And we're already seeing toxic effects. We're seeing that people who vape have a higher incidence of heart attack and stroke. We don't yet know definitively about the risk of lung cancer, but I'd say that strong statements by the industry shouldn't be made until we have more definitive data to show.
Dr. Zafia Anklesaria, thank you so much for being here for the first time.
Pleasure.
Good to have
Thank
you here
you.
from Dignity Health, California. Thank you so much.
Insightful. Thank you.